Really enjoy coming here to share our experience and to share data from Quebec and to learn about your challenges. So today my talk is about early childhood education programs in Quebec. How can we raise the bar? And I'm going to talk more about the challenges we're facing than our success story. Let's start with something we all remember very well, the UNICEF Innocenti report in 2008, where we didn't fare very well as a nation. And you know that we're like behind many of the counterparts in the OECD, and we only came in second to last. Ouch. I was supposed to be the spokesperson for this report in Quebec, and I didn't get any calls. No, I got one call from a very small paper which probably needed to fill a spot somewhere to talk about the report. And why? Because in Quebec we generally think we're so much better. We are so much more advanced. I looked at the indicators for Quebec, and Martha, you can correct me, but I think I couldn't find more than 4, and even that I wasn't sure about. So 3, exactly. The fourth one I wasn't 100% sure. So we're not doing that well in Quebec. But why did we think we did so well? Because over the past decades, things have happened in Quebec, and I don't want to be too redundant, but let me just remind you that since '97, we have a family policy which really heavily focused on the development of early childhood education and childcare services, with the idea to provide universally accessible programs with the perspective of fostering school readiness. We talk a lot about school readiness, and we really wanted to make sure that all the children get onto a right start, a good start, and just close that gap that we observe so often once children come to school. So, childcare services for children aged 0 to 5, before and after school programs for school-aged children, all that with low parental contribution. It used to be $5, now it's $7 a day, which you say, wow, you know, that's a real good situation. But there are other measures, and I think they touch more on what you're considering right now. We have half-day pre-kindergarten classes for 4-year-olds since 1970, which was then the Opération Renouveau, inspired by Head Start, as a targeted intervention for children in low socioeconomic areas in Montreal. And half-day kindergarten for 5-year-olds. Since 1990, full-day kindergarten for 5-year-olds was implemented as a universal intervention, and a preschool curriculum, which is the original. It's an adaptation of the high school curriculum. Jouer c'est magique, play-based learning, you're all familiar with, was implemented in the early childhood centers and the 4- and 5-year-old maternelle, theoretically. At present, we have a particular situation which is very pertinent to you, and you know you are facing too in a certain way, that we have childcare settings which cater to the 0 to 5, but the schools also offer services for 4- and 5-year-olds. So there's an overlap and a certain struggle between the two ministries. Who is going to get the 4-year-olds? And there are lots of discussions about we should have all the 4-year-olds in the schools, which I think is partially motivated by the fact that we will have a lot of unemployed teachers, given that the population of children has decreased. So far I haven't seen an ideology behind it. It was more practical consideration. Nothing has been decided, but there are issues about the 4-year-olds and loyalties which are very difficult for a researcher. You know, what should you recommend on what basis, but we'll get to that. So, childcare settings, parental contribution, $7 a day, different settings, for-profit, not-for-profit, home-based care, unregulated home-based care, which is alive and well in Quebec. I won't go too much into that because time passes quickly. In the schools, the advantage, of course, is that school is free. Unless you use the after-school childcare, you pay $7 a day. The school is free. So where are our 4-year-olds? We know at age 5 it's almost universal. Almost all kids are in the maternelle, in the pre-kindergarten probably. We have at present, and don't forget it's a targeted intervention, the 4-year-old kindergarten, we have about 20% of the population who are in public and private, because we also have a private sector that is alive and well in Quebec, and a lot of private schools offer maternelle, 4 ans, 5 ans, 4 or 5-year-old kindergarten, and so about 20% of the children are in these kinds of settings. What do we know about the quality of the preschool settings in Quebec? We have 3 surveys, and we have talked about the You Bet I Care. The data was collected in '98, I think, but the report came out in 2000. We have, and I will go more into detail about the Quebec Longitudinal Study of Child Development, which gives us a very complete profile of the quality, including the school-based settings. And we have Grandir en Qualité. You may have heard about that study, which was undertaken in 2003. The ministry decided to develop their own quality tool and go out and get a profile of what the situation is like in our childcare settings. We use the French adaptation of the Itters and Eckers in You Bet I Care and in the Quebec study of child development. You know the instrument, I don't have to go into detail. It's one of the instruments, and I think you mentioned it, that the scale is from 1 to 7. We can use it as a continuous quality scale for each item subscale, global score, or we can have categories. Scores from 1 to 2.9 are indicative of inadequate quality, safety and health risks, and no educational component. 3 to 4.9 is minimal quality custodial care. The bases are covered, but our educational component is also minimal. And anything from 5 to 7 is what we really would like to see, because there we have all the bases are covered, but we are really fostering child development. Now, I'm just going to give you the scores. I've looked at the Quebec sample of the You Bet I Care. Small, as you see, very small, and one of the problems in this kind of research is always the selection effect. We know that the best child care settings are the most open to have somebody come in and observe quality. So in You Bet I Care and also in the Quebec Longitudinal Study on Child Development, there's definitely selection effect. So all of the scores, and Grandir en Qualité has its own scale, which is from 1 to 4, but globally we can say quality is mediocre. It's not up to the level we want it to be, the level we know should be, could be, will be more beneficial for our children. The LDEC, as I mentioned, I don't know to what extent you're familiar with it. I don't want to be too repetitive, but it's a fascinating study of child development that started in 97-98 with a representative sample of children in Quebec. Presently, they're in grade 6. They're finishing elementary school, and there's lots of exciting data. And like every researcher, I wish I had more time to play around with the data, but you know, there are still a couple of years left. So what does the quality data show? And we use the Eckers because we started to get money to go in and observe the childcare settings when the children were 2.5 years old. So the data I'm presenting is for the 2.5 to 5 year, which is about the age group we're talking about here, going into schools. As you can see, the majority, and I mentioned it already, the majority of the settings are of minimal quality. They're still 13% inadequate, and about 1 in 4 that ranks at 5 and more. Interesting aspect, and you have observed that here, as it's observed elsewhere, differences with respect to hospice. The non-profit centers are much more likely to be of better quality than the for-profits, and that slide may not be very clear, but I looked at the Eckers scales and looked at those who scored good to excellent, remember 5 and plus, by type of setting. So the non-profits are our CPE, Centre de la Petite Enfance, or early childhood centers. versus the for-profits. And you can see there are many more non-profits that are of good quality than for-profits. In the family-based care, the regulated ones that were associated with the CPUs still are, but that system has changed too, do much better than non-regulated family-based care, and there's still a lot of children in that setting. On the other side, you see it's the other side of the medal, the poor settings, those that rank below 3. We still have some CPEs, but the for-profits are heavily represented in that area. Such are the non-regulated family-based settings. But let's look at the 4-year-olds. I looked at the data when we collected it when the children were 4 years old, because the LDEC, I think, is the only study, I think it's the only quality data we have in Quebec on pre-kindergarten that 4-year-olds attend. Measured with the ECHRs, because as you mentioned, Michal, the quality standards apply to all the children, no matter where they are, in whatever setting they are. Their developmental needs are the same. And we see that comparing to the quality in our early childhood centers, the quality observed in our actual settings of 4-year pre-K, they're lower. The quality is lower. If we look at the different subscales of the ECHRs, we see that there's a difference with respect to space and furnishing, and I could talk about a lot of these dimensions for a very long time, but I don't want to take too much time. There is a big difference, significant difference. Always, the for-profits are always the lowest, we know that, huh? That's kind of established. Personal care routine, activities, the quality of activities. Interesting enough, language and reasoning and interactions, they're both the same. But to me, there are two issues. Those are dimensions that are very difficult to assess. Huh? If we send people out, training them to assess the quality of language and reasoning takes a lot of work. And I think we have a lot of iterator variability in that. But there's also the training issue. You know, we see preschool teachers and qualified or educators in early childhood settings, they're doing fairly well on that level. But I question sometimes the criteria and the validity of the evaluation. How does Quebec monitor quality in early childhood education programs? Now we have that profile, we know it's not that rosy, but what is the government doing to make sure it's not getting worse? In the childcare sector, again, we have this dichotomy and this issue, which I think you have had too, but it seems to be changing, that there are two ministries. The family ministry, which is responsible for the childcare sector, and pre-K for 4 and 5-year-olds is part of the Ministry of Education. So there's not much communication. On the contrary, I think right now there is more of a conflict because of who gets the 4-year-olds. So since I have to go back a little bit in history, in 2003, we went to the National Assembly to present the quality data to policymakers to tell them, hello, it's not enough to create spaces. We can be very proud of the number of regulated childcare spaces we have in Quebec, but that is not enough. Let's focus on quality. After that, the government decided still to open up the private sector, and I mean, decisions that were not really taken into account. The data, so evidence-based politics, not. In that sense, what was really interesting, we have regroupement, we have associations of early childhood centers. They really were mobilized by the data. And they put into place quality committees. And I was part of some of the quality committees, but the decisions that were taken in terms of improving quality, in some cases were not, in my opinion, not the best. Developing a self-evaluation tool, I think we just heard about what all the researchers, everybody thinks about self-evaluation. There is a heavy-duty bias, so not the best way to go. I'll tell you about a little pilot project which comes out of these initiatives, which to me seems a promising venue for quality improvement. But what did the government do? Since 2005, we have what we call the Ongoing Quality Improvement Plan. And what does that mean? You can look it up on the internet of the Ministry de la Famille et des Aînés. It's a piece of paper that every CPE and garderie signs to show their devotion or their engagement for improving quality. It's a piece of paper that is signed. There is no funding allocated and there is no direct support. Okay? We have still some mechanisms built in. We have 14 inspectors that, let me tell you, we have about 1,300 settings, including the for-profits. I haven't been able to figure out how many for-profits we have, and they're growing so rapidly, I'm kind of losing touch with the numbers. So we have 14 inspectors that are supposed to go in and verify that these childhood centers are respecting the norms, you know, which are at the basis of their permit, which, if I calculate right, and from speaking to people in the field, it's not even once a year. Somebody comes by, looks at what's going on, but purely on structural matters, health and hygiene. Those inspectors have, excuse me, very, very few notions about quality. And as a matter of fact, their messages are very often contradictory. And so there's no quality monitoring as such, but we make sure that the playground is safe, that we use the right disinfectant for diaper changes, and so on and so on. There are pedagogical, I just realized, we have pedagogical consultants within the early childhood centers, which are supposed to support staff in quality improvement. However, if you look at the job description, what the pedagogical consultants are supposed to have, they are educators. They are not qualified as pedagogical consultants. So they're not further ahead necessarily. They may have a couple of years more experience, but they're not the kind of person who would really be able to, exceptions granted, to consult and monitor quality. In the school system, there's absolutely no monitoring of quality. For the 4- and 5-year-olds, yes, there is a curriculum which is also play-based, which, the basic guidelines are the same as Jouer c'est magique. We have pedagogical consultants at the school board level for the 4- and 5-year-olds, but of course a pedagogical consultant is somebody who's consulted when you have questions. He's not the person, he or she is not the person to come in and say, you have to do that. This is not up to the standards of quality. They sound negative, huh? I'm sorry, but we're here to make things better. So, there are also various initiatives to enhance quality in the childcare sector, mostly funded by a private foundation. However, none of them are direct monitoring of quality. It's more about, well, we'll give some training sessions to educators, but we're not looking at if those training sessions have a direct impact on quality, always quality based on the standards which we've heard about already. Now, I'm just going to talk briefly about my little project, a pilot project, and I want to be humble about it. It's very small. It was a very exciting project because it came out of this time when everybody was kind of going, what are we going to do about quality? So I got a little research fund and worked with one of the associations in the Eastern Township, such a beautiful area, but a bit far away. And after having the QLSCD results, we said, what can we do? And I said, well, why don't we just evaluate quality based on the standards? I mean, the ECHRS, and I chose the ECHRS additional challenge for us. We have to work in French. There are not too many instruments that are translated into French, and there are very exciting instruments out there, but okay, that was possible. We had data, we could compare it. So we took the ECHRS and we evaluated daycare settings, childcare settings, and then offered coaching sessions based on individual profiles. I'll just race through the methodology. It's not very important. Excuse my very dilettante profile or image of a systemic, ecological approach to how we can improve childcare, but as Peter said, The child is at the center. We are there for the children aren't there for us. So how can we improve the daily experience of our children in childcare and the working conditions of the people who are with these children all day? So my project came out of the idea, I'm not going to change social policies. I'm not going to change the rules and regulations right now, but I can work directly in a proximal way with the childcare providers and improve the immediate environment as much as can be improved, and the interactions and their interventions. So we had small, as I said, humble, 30 childhood centers in the eastern townships. We used the ECHRs to get people involved, and I tried to be really rigorous in terms of methodology. You know, we took 10, as you will see, 10 groups were chosen at random to be part of 3 different groups. We had 10 CPE, which served as kind of a control group, which did not get any training or coaching. We had a group of 10 CPEs where we trained administrators about the concept of quality, like a short ECHRS training, a 1-day short ECHRS workshop. Why do we care about quality? These are the parameters of quality, the dimensions, and how to observe it. I mean, really introduction. And then we had our group, our heavy-duty intensive group, where we trained the administrators, and we offered 3 sessions of coaching to the personnel and the administrator. We wanted them to be there, which wasn't always the case. So it's small, it didn't have much money. I couldn't pay more than 3 sessions of coaching, but we learned from these experiments. We want evidence-based politics, so we have to create evidence, humble as it may be, and small as it may be. So let me tell you also that to mobilize all these CPEs, everybody got their profile. Even if they didn't have administrator training or coaching, after evaluating everybody, observing everybody with the ECHRS, everybody got a little profile to show where they were at the different subscale levels. So short-term evaluations after the coaching, 3 months afterwards, we went in and we looked at the dimensions that were addressed and could be modified. Space and furnishings, we increased the score quite well, you know. Personal care routines, language and reasoning and interactions, marginal. Activities, the score increased. But interactions, language and reasoning is a real challenge, because we're talking about personal characteristics of the educators, of the child care providers, and that requires, in my opinion, much more than 3 training sessions. But we managed to modify certain elements in the environment and safety. Health and safety, hygiene matters. Personal care routine, it's an issue all across the board, all across the provinces. I think we share that with everybody. And activities, and they're all linked. As you know, the ECHRS is kind of a synergy. If you modify one element, it most likely has an impact on other dimensions. I don't want to go into details because, anyway, all 3 groups improved. I'll show you the graph. All 3 at the end, 1 year afterwards, we went back to see, let's see what happens 1 year afterwards. Has anything been left over from those training sessions? And 1 year afterwards, all 3 groups had a higher score, which is easily explained because it's a small association, and I think there was kind of an internal challenge. We'll all do something about it, even if we didn't get the coaching. And they all got their profiles, so they knew what to address. But the first group, the group that got the coaching, still statistically did better than the group that did not get coaching or administrator training. And those results are most visible on the subscales that were part of the coaching sessions, because a lot of people worked mostly on space, the environment, and personal care routines. We see the effect here is quite visible. Now, I'm going to skip that because that's about everything else. But the project continues after the pilot project. The people in the childcare settings in the Eastern Townships were so motivated. It was so empowering that they could do something, because we also had a general depression in the childcare sector after having the results followed by cutbacks. So being able to do something about it makes people feel better, more motivated, and so on. So we got money to expand the project to all the other CPAs and all age groups, because remember, we only had 2.5 to 5. And another big association in Quebec has implemented this program since 2007. And since it's very difficult to get funding for these projects, it's a certain kind of formula we developed. I provide them with the expertise, and in return they give me data which allows me to document what's happening in quality. It's not representative for sure, but are we going up or are we going down? So we're going down. That's just the latest data from the pilot projects, from the Eastern Townships and Quebec. Has childcare quality improved over the past 5 years? No, we have many more inadequate settings than we used to have before, particularly, and this isn't data we had before, among the infant and toddler care, and I think somebody mentioned that before. We don't know enough about infant and toddler care, and that is really critical. But that's another presentation. So the challenges of this kind of coaching to improve quality is the training of the observers. When I did my pilot project, I had 2 people with a master's in child development, extensive experience in childcare, and they knew what they were doing. They were coaching, they knew the standards, they knew how to work with groups, with the resistance. There's a lot of resistance out there. I mean, who likes to be told, it ain't that great? Huh? You think you're doing well, but we have things to improve. Interrater reliability, costly. Huh? You have to make sure. Supervision of observers, ongoing supervision of the coaches, reluctant participants, and one of the problems in our childcare settings, the significant staff turnover. We might have a quality initiative, but a year later, 50% of the initial staff isn't there anymore, which comes back to something that we're trying to look at now with the data, the knowledge and leadership among administrators. I think even if there's staff turnover, if we don't have leadership, we're going to lose out a lot of the energy and the training we're investing. And of course, the eternal question, how can we finance it? So to come back to, finish with this, to efficiently monitor and improve quality in early childhood education programs, I'm repeating a lot of what has been said already, but I think leadership on every level is so important, an understanding of what quality is all about, because it's such a vague concept for so many people. And if you go into a room with administrators and you ask them for a quality definition, you come up with so many different aspects of quality. But we have to have a clear idea, what is quality, an environment that is of high quality for our children. Qualified educators and teachers, a challenge in Quebec as well as here, I suppose. Measures, as we mentioned, that meet validity and reliability standards. There are many measures out there. Assessments by well-trained third-party observers, a big, big issue, because otherwise our data isn't worth very much if people don't know what they're assessing, or if they slip in their level of validity. Monitoring on an ongoing basis, on-site assessments and training. Training should be on-site. People, what I always hear is help us, give us tools, tell us what to do. So that's why I'm critical of those wonderful workshops that are provided somewhere outside, where we talk about what is attachment to improve childcare quality, and nobody ever looks at does this kind of training have any impact on the child's environment and the quality of the child's environment. And of course, financial commitment to integrate this process of monitoring and training into all preschool programs. And this is it. Merci beaucoup.